My grandkids were real young. When they saw me with my legs missing, they couldn't take it. They cried all the time, you know. I thought my grandfather was gonna be a whole man, you know, but I'm only part. It's all because from not eating the right foods when you're young.
We've had the foundation of this long history of the best in clinical care, but we're adding elements to this which are going to make the work that we do very much more effective.
It goes beyond just taking care of patients.
We look at that in a person as a person without illness, and that's the special part.
We at Rogosin have always believed patients aren't defined by their medical problems, they're defined by who they are. And the Institute has a heart and a soul.
The problems that we see in communities, they didn't just happen overnight. So we know that the effort and the fight, it's not going to change overnight.
I always tell y'all that I'm not going to be here forever, and Daddy's not going to be here forever neither. Y'all have to absorb everything that we try to teach y'all about life, because I grew up around so much violence. So it's my job, you know, that I have to protect and keep my children safe. My kids is the reason why I do a lot of things. My kids is the reason why I get up. I hope they never develop diabetes. I hope they never develop no sickening disease that'll cripple a person or make them ill.
What do we do to get people to take responsibility for their own health? I think what Rogosin has done is tell people, hey, you're a part of this. We're in this together. We are going to help you, and you're going to help us. It's not a one-way street.
We have a health and education program that is conducted 5 days a week. We make sure that the community members are a part of the design.
It translates into action because people begin to identify problems that are important to them, and then they take ownership of those problems.
The reason I started To the Hood was basically to get people out riding and so that they could experience the community. And so that actually gives people a small aerobic workout. It gets in their mind that they can actually go out and do something. When we can teach the kids early, then we can prevent problems, and that's what we have to do.
The more that we get people exercising from childhood on, the more it becomes a way of life. And as you become more fit, your risks of conditions like diabetes and heart disease, as well as kidney disease, decrease dramatically.
What we start to see is this metamorphosis of a human life totally changing holistically. And then not only is that life impacted, but the life that is connected to that life is impacted. So we see the whole family dynamics change. It spreads, and then all of a sudden, as life goes on, then you see a whole neighborhood have the propensity and the possibility of change.
You don't change a community with one visit. What you're doing is sowing seeds.
When we begin working in a community, we are committed. We become a part of the fabric of the community. We're not just the catalyst, but we become a partner.
Everyone is capable of solving some of the health problem that we have. And so what we need to do is unleash the potential of people to do that.
You can't do the work without partnering. The work is not going to be successful if you're not engaged with the community for the long term.
When they said that they would come here and they would be here for a long period of time, I did not believe that they would be here beyond a few years. And I've seen them here now for 15 years. That is like no other foundation that I know.
We live in a very impoverished area. Out of the 82 counties, we're number 80 in poor health.
It used to be so healthy, robust, and now it's almost like a ghost town.
We, as a community, will have to work together to solve these problems.
In Clarksdale, we don't have that many nurses. not enough people getting the education that they need.
We decided that we would do a high school mentorship program.
The idea behind it is to create a pathway or a pipeline from middle school students up through college students, getting people interested in pursuing careers in healthcare, providing educational and mentorship support along the way.
This program gives them hope of just living out their dream. Growing up, you can say you want to be a doctor, you can say you want to be a nurse, but if you don't have the resources or you don't have all of the educational material in front of you, you know, those dreams will end up being hopeless.
The nursing program helps people to strive to do better things with their life.
This program is not just impacting their own individual lives, but they're really moving out and impacting their families and their communities as a whole.
I want the students to have the best opportunity that they can to make a life for themselves, a self-sustaining life.
Hopefully with our young kids like Teal and the other students that is in this program, hopefully they can bring about a change to uplift Clarksdale again.
I see it as a movement that needs to happen around the U.S. and the world.
Good health and health care is not the province of health professionals alone. It belongs to all of us. What we're doing is building an enterprise together that is not only socially responsible, but it benefits all of us working together. And unless we do it together, we're not going to create the best possible system.